Hello, and thank you so much for joining me today. My name is Melissa Devine. I am with the Medicare Medicaid Assistance Program through the Area Agency on Aging 1B, and today we're going to discuss how to transition from the marketplace to Medicare. Let's get started. Throughout the presentation today, we will cover the Medicare Medicaid Assistance Program, often referred to as MAP, understanding what Medicare is and how the Affordable Care Act and Medicare coincide, marketplace to Medicare, how to transition, when to transition, and some Medicare basics, including Part A, Part B, Part C, Part D, and more. The Medicare Medicaid Assistance Program, or MAP. Michigan Medicare Medicaid Assistance Program, or MAP, is a free health benefit comprised of unbiased counselors located all across Michigan. MAP counselors are certified and have been trained in healthcare benefits counseling. This includes Medicare, Medicaid, and other insurance products. MAP counselors are not connected with any insurance company, and they are not licensed to sell insurance. In many states, the MAP program would be considered the SHIP program. That's the State Health Insurance Program. So what can a MAP counselor do for you? Well, a MAP counselor can help you understand new healthcare options, understand Medicare and Medicaid. We can help you compare or enroll in your Medicare prescription drug coverage. We can help you review Medicare supplemental insurance needs. We can help you understand Medicare health plans, help you apply for Medicaid or the Medicare Savings Program, and of course, we can help you identify and report Medicare and Medicaid fraud and scams. Now let's take a look at Medicare. What is Medicare? Medicare is health insurance for three groups of people: those 65 and older, those under 65 with certain disabilities, and those of any age with end-stage renal disease, or ESRD. It is administered through the Centers for Medicare and Medicaid Services, and to enroll, you'll do so through either Social Security or the Railroad Retirement Board if you're a railroad retiree. Originally, Medicare was created in 1965 as a catastrophic health care coverage for seniors and the disabled. There are gaps, meaning deductibles and coinsurances that the beneficiary must pay, and any modifications require legislative actions. Medicare has been expanded over the years to include, among other things, prescription coverage and preventative services. Medicare has well-defined benefits and exclusions. Medicare does not cover dental or vision care except under special circumstances or through a Medicare Advantage plan. It does not cover long-term custodial care. It places limits on certain care items such as physical therapy, durable medical equipment, and more. Medicare also does not cover over-the-counter medications. Medicare works with private insurance companies to provide Part D prescription coverage, supplemental plans or Medigap plans to fill in the gaps in original Medicare, and Advantage plans. Those are plans that combine parts of original Medicare, usually with prescription coverage, and often some dental and vision coverage. The Affordable Care Act of 2010, also referred to as the Healthcare Reform, included a number of provisions that affect people with Medicare as well as those aging into Medicare. Under the healthcare reform, people with Medicare now have little to no cost for many preventative services. Some of these services include an annual wellness visit, cancer screening tests such as mammograms and colonoscopies, and a welcome to Medicare physical. The Medicare Part D coverage gap, sometimes called the donut hole, occurs when a Medicare beneficiary exceeds a certain amount on their prescription drug costs during the year. Previously, those who reached the donut hole would be responsible for paying the cost of their prescriptions in this gap. The Affordable Care Act has helped to close the coverage gap by enabling people who reach the donut hole to receive deep discounts on their medications. In addition, the Affordable Care Act expanded health care coverage to all Americans through the creation of federal and state marketplaces where individuals and small businesses can purchase insurance. These marketplaces are designed for individuals who do not yet have Medicare. Yet many people have questions about how they work for older adults and how those enrolled in the marketplace plans can effectively transition to Medicare when they first become eligible. It's important to note that no Medicare products are sold in the marketplace. Those with Medicare who wish to enroll in a Medicare Advantage plan or a Part D prescription drug plan and a Medigap or supplemental plan should continue to do so through Medicare.gov, Medicare plan brokers, or the plans themselves. Marketplace to Medicare. If you are turning 65 and are currently enrolled in a marketplace plan, you may have a lot of questions. First is going to be, what do you do next? Well, when you're first eligible for Medicare, you should enroll in Medicare. You are first eligible for Medicare when you turn 65. You will have an initial enrollment period that begins 3 months before you turn 65, the month that you turn 65, and it ends 3 months after you turn 65. If you have a marketplace plan, you can keep it until your Medicare coverage starts. But once you have an effective date for your Medicare coverage to begin, you will need to notify your marketplace plan to disenroll from it. If you like, you can keep the marketplace plan too. But once your Medicare Part A coverage starts, you'll no longer be eligible for any premium tax credits or other cost savings that you may be getting for your marketplace plan now. So you'd have to pay full price for the marketplace plan, and if you delay your enrollment into Medicare to keep the marketplace plan, you will end up with a late enrollment penalty when you do choose to enroll in Medicare. And in some cases, you may risk delay into the Medicare coverage. If you and your family are enrolled in a marketplace plan together prior to you turning 65, you can make changes to your coverage by disenrolling yourself only from the marketplace plan and enrolling in the Medicare coverage for just yourself. What if you were automatically enrolled into Medicare? Well, automatic Medicare enrollments only take place when you're drawing Social Security retirement or Social Security disability payments. When you're receiving these benefits, you must take Medicare. If you were to choose to delay enrollment into Medicare for a marketplace plan, you will have delays in coverage to Medicare, be subject to late enrollment penalties, and more. If you choose to delay enrollment into Medicare, you'll lose your Social Security benefits. You'll have to pay back any prior Social Security benefits and will pay back any health benefits that you'd received from Medicare prior to canceling the coverage. Can I have both Marketplace and Medicare? Yes, but they will not coordinate. One coverage will not pay secondary to the other. And as long as you continue to pay your Marketplace premium, the insurance company cannot drop you. You will have to choose if you will use the Marketplace plan or Medicare for the health services that you are receiving. Again, you will not receive the Marketplace premium tax credits either once you're enrolled in Medicare. When should I cancel my Marketplace plan? Well, as soon as you know your effective date for Medicare, you should log into your Marketplace account and select to terminate the plan for the day or even a time frame in the future of 30 days. You can also call 1-800-318-2596 to disenroll as well. And if a family member is remaining on the plan, cancel your coverage only 15 days prior to the end date that you are requesting. Medicare Basics. If someone's already receiving Social Security benefits, for example, early retirement, they will be automatically enrolled in Medicare Parts A and B without an additional application. They will receive an initial enrollment period package, which includes their Medicare ID card and other information. This takes place 3 months before you turn 65, or 3 months before the 25th month of disability payments. If someone is not getting Social Security or Railroad Retirement Board benefits, because maybe you're still working, they will need to sign up for Part A, even if they're eligible to get it premium free, and they should contact Social Security 3 months before turning 65, and if they worked for the railroad, contact the Railroad Retirement Board to sign up. While Medicare is administered by the Centers for Medicare and Medicaid Services, Social Security Administration is responsible for enrolling most people in Medicare. The Railroad Retirement Board is responsible for enrolling railroad retirees into Medicare. If you are not automatically enrolled, you can choose to sign up for Medicare during your initial enrollment period. You can sign up for Medicare anytime during a 7-month initial enrollment period that begins 3 months before you turn 65, the month that you turn 65, and for 3 months after you turn 65. During the initial enrollment period, you can choose whether to enroll in both Medicare Parts A and Part B. If you enroll in both, you will pay a monthly premium for Medicare Part B. This year, for 2021, for most people, that amount is $148.50 a month. Social Security advises people to apply for Medicare benefits during the first 3 months of their initial enrollment period. You do not have to be retired to get your Medicare. In fact, the full retirement age for Social Security retirement benefits is currently 66 and 10 months old. And it will gradually increase to 67 for persons that are born in 1960 or later. But you can still receive your full Medicare benefits at age of 65. If you sign up during the first 3 months of your initial enrollment period to get your Medicare coverage, this will make the coverage effective the month you turn 65. However, if your birthday is the first day of the month, your coverage will start the first day of the prior month. And if you wait to sign up until the last 4 months of your initial enrollment period, your effective date will be delayed. This is the original Medicare ID card. It's red, white, and blue, and is used when a beneficiary gets health care. The Medicare ID card shows the Medicare coverage, Part A for hospital coverage and/or Part B medical coverage, and the date in which the coverage starts. The Medicare ID card will also show your Medicare claim number. If you choose another Medicare health plan option, like Medicare Advantage, your plan may give you a card to use when you get healthcare services and supplies. If any of the information is incorrect on your card, you'll want to reach out to Social Security or the Railroad Retirement Board if you receive railroad retirement benefits. And if you don't want Part B, follow the directions on the back of the card and return it. Now, there are 4 parts to Medicare. Part A is hospital insurance. Part B is medical insurance. Part C is Medicare Advantage, like an HMO and a PPO, and it typically combines Part A, Part B, and Part D together into one plan. Part D is a Medicare prescription drug plan, and it covers your prescription drugs. When you first enroll in Medicare, you have two different ways to choose your Medicare coverage. The first would be to enroll in Original Medicare. This includes Medicare Part A, hospital insurance, and Medicare Part B, medical insurance. You can then add on a Medicare Part D plan for prescription drug coverage, and also add on a Medigap or Medicare Supplemental Insurance Plan. These Medigap policies help pay your out-of-pocket costs with Original Medicare. Route 2 would be to enroll in a Medicare Advantage plan or Medicare Part C. These plans are like HMOs or PPOs, and they typically include Medicare Part A, B, and D coverage all in one. Medicare Part A hospital insurance helps pay for medically necessary services like hospital inpatient care, including semi-private rooms, meals, general nursing, and other hospital services and supplies, skilled nursing facility care, not related to custodial or long-term care, but when certain conditions are met, home health care, hospice care, and any blood transfusions needed as an inpatient. Medicare Part B covers a number of medically necessary services and supplies, including doctor services, outpatient medical and surgical services, home health care services, durable medical equipment, and preventative services like exams, lab tests, screenings, and shots to help prevent, find, or manage a medical problem. Preventative services may find health problems early when treatment works best. This table shows some of the various costs for hospitalization with Medicare Part A. For most people, there is no monthly premium for Medicare Part A. However, if you've only worked between 30 to 39 working credits, you may pay a $259 monthly premium. Or if you've worked less than 30 working credits, you may pay $471 monthly in a premium. This chart shows the general charges for Medicare Part B. And if a client is also eligible for Medicaid or extra help, these charges may be reduced. The monthly premium for Medicare Part B is $148.50. What is Medigap? Medigap, or Medicare Supplemental Insurance policies, are private health insurance that covers the policyholder. They are sold by private insurance companies to help supplement the original Medicare gaps, like deductibles, coinsurance, and copayments. They pay for Medicare-covered services that are provided by any doctor, hospital, or provider that accepts Medicare. Medigap may even cover certain things Medicare doesn't, depending on the Medigap plan. They must follow federal and state laws that protect people with Medicare. We could do an entire presentation on Medigap, but the next few slides will show what Medigap policies cover. And if a beneficiary wants or needs a Medigap policy, please reach out to MAP. Medigap policies all cover basic benefits, while some letters cover additional. The basic benefits that are covered by all Medigap plans include the following: the Medicare Part A coinsurance and hospital coverage up to an additional 365 days after the Medicare benefits are used up. The Medicare Part B coinsurance and or copayment, the first 3 pints of blood, and the Part A hospice care coinsurance or copayment. For plans that offer additional benefits, you may see coverage for skilled nursing facility coinsurances, the Medicare Part A deductible, Medicare Part B excess charges, and even some foreign travel emergency coverage up to certain plan limits. Medicare Part D is coverage for your prescription medications. While technically Medicare Part D is optional, in most cases, there are late enrollment penalties to not enrolling in a Part D plan right away. Part D can also be the most complicated part of enrolling in Medicare. It involves researching plans, comparing prices, and more. MAP counselors are trained to assist beneficiaries and take the stress out of enrolling. These plans are provided by private insurance companies, and enrollment in these plans are not automatic, so you will have to choose the plan that you want to enroll in. Each plan has a set list of covered medications, also known as a formulary list. So checking to make sure that your medications are covered is very important. You also will pay the drug plan monthly premium and pay a copayment for each medication and or a yearly deductible towards the plan. For people with limited income and resources, you may be able to get extra help to pay for the medications and the Medicare drug plan itself. Medicare Part D is available for all people with Medicare. You can have just Part A or both, Part A and B. You must live in the plan service area. You cannot live outside of the U.S. You cannot be incarcerated. And you must enroll in the plan, in most cases by completing an application. A MAP counselor can help with this and reduce the stress of picking out a Medicare Part D plan. You can join a Part D plan during your initial enrollment period when you're new to Medicare. Your initial enrollment period is that 7-month time frame that begins 3 months before you turn 65, includes the month that you turn 65, and the 3 months after you turn 65. After you enroll in a Medicare prescription drug plan, you must remain with that plan for the rest of the calendar year. You can also make changes or enroll in a Medicare Part D plan during the annual coordinated election period. This is also known as open enrollment. It takes place October 15th through December 7th each year. There are also times when someone can disenroll or enroll and get a special enrollment period. All of this is covered in the Medicare and U-Book, which is provided to all Medicare beneficiaries each year. And if you have more questions, you can always contact a MAP counselor for more assistance. If you do not have creditable coverage and do not enroll in Part D, then you must pay a late enrollment penalty when you finally do enroll in Medicare Part D. The penalty is added onto the monthly premium, and it will continue for the entire time that you have Medicare Part D. The Part D late enrollment penalty is calculated by taking 1% of the Part D base beneficiary premium for each month that a beneficiary does not have creditable coverage and is not enrolled in Part D. The penalty amount does change each year as the Part D base beneficiary premium changes each year. For 2021, the base beneficiary premium is $33.06. This is just a quick look at the Medicare Part D coverage phases. In the deductible phase, if a plan has a deductible, you will start the year in the deductible phase. That means that you pay the full negotiated price for covered prescription drugs until you've met that deductible amount. Then, once the deductible amount has been met, the plan will begin to cover the cost of the medications. Once you enter into the initial coverage period, and you've met your plan's deductible if there is one, the plan will help pay for your prescription drugs. Typically, you'll owe a copayment or a coinsurance for your covered meds. Once you have met a certain amount between you and the plan, you'll enter into what's called the coverage gap. So, in that gap, you'll owe 25% of the cost of the medications. And after you've reached a certain amount in out-of-pocket costs, you'll then enter into the catastrophic coverage level. During this time, you'll owe a lower amount for the cost of your covered medications. Medicare Advantage is also called Part C. They are health plan options approved by Medicare, run by private insurance companies, and generally are either an HMO or a PPO. Medicare pays amounts for each member's care in the Advantage plans, and they're another way to get your Medicare coverage. If you do join a Medicare Advantage plan, though, you will have to use their network doctors or hospitals. Medicare Advantage plans, or Part C, are health plan options that are approved by Medicare and offered by private insurance companies that sign the contract with Medicare. They are a part of the Medicare program, which means that Medicare pays a set amount of money to these private health plans for their members' health care. In a Medicare Advantage plan, you may have to use their doctors and hospitals that belong to the plan or are in-network, but you still have access to all of the Part A and Part B services. You may even have prescription drug coverage, and you may even get extra benefits like dental, vision, hearing. Each plan may have a different cost sharing, and the benefits may vary. You can join a Medicare Advantage plan when you first become eligible for Medicare during that 7-month initial enrollment period. That initial enrollment period, again, begins 3 months before you turn 65. It includes the month you turn 65 and 3 months after you turn 65. You may also change or enroll in a Medicare Advantage plan during the annual fall open enrollment period, which is October 15th through December 7th each year. If you make a change to your coverage or choose to enroll in a plan during open enrollment season, the coverage will begin January 1st the following year. There's also an open enrollment period for Medicare Advantage plans January through March each year. However, you must be enrolled in a Medicare Advantage plan prior to January to utilize the Medicare Advantage enrollment period. You can contact the plan to join by calling their number, visiting Medicare.gov, or contacting MAP for more assistance. There are programs available to help people with limited income and resources pay their Medicare costs. These include Medicaid, the Extra Help Program, and Medicare Savings Programs. If you think you might qualify or need help, call MAP today and we can set up a private appointment with you. Medicare fraud is the most common scheme that affects seniors. Medicare and Medicaid can be billed for services that you never got, or equipment that you never received, or equipment that was returned. If someone uses your Medicare or Medicaid card, or if a company uses false information to mislead you into joining a Medicare plan, give MAP a call. We can assist you if you feel that you are a victim of fraud or abuse. MAP is here to help you. If you want to speak with a counselor about your specific situation, just give us a call. We are counseling currently over the phone and through Zoom. Our services are confidential and unbiased, and no question is too trivial. We often deal with the very complicated questions as well. For more information, visit Medicare.gov, refer to your Medicare and You handbook, contact 1-800-MEDICARE, or give MAP a call. Our number is 800-803-7174. MAP is here to help you. Thank you so much for joining me today. Have a wonderful day.